Welcome to my knee guide. This video will take you through the steps of knee replacement surgery. I will do this with the use of anatomic models. First, once you're brought back to the operative theater, your knee will be prepped and draped. The surgeon will then make an incision along the midline of the knee. He or she will dissect through the soft tissues to get to the extensor mechanism. The extensor mechanism consists of the quadriceps tendon, the patella or kneecap, and the patella tendon. The surgeon will then make an incision along the inner aspect of the extensor mechanism. Traditionally, this incision is brought up along the edge of the quadriceps tendon. However, some surgeons will take this incision either through or beneath the vastus medialis muscle. The surgeon then has the ability to slide the kneecap to the side or evert it in order to get access to the deep structures of the knee. At this point, the surgeon may encounter bone spurs or osteophytes, which can be resected off of the edges. The surgeon will identify the anterior cruciate ligament, and this will be resected and removed. This gives access now to the posterior cruciate ligament, or PCL. Now, the PCL may or may not be removed in your particular surgery. The decision for removal of this ligament depends on surgeon preference and your particular anatomy. You can learn more about the indications for retaining or removing this ligament in the prosthesis section in the Learning Center. This now gives access to the menisci, which are the cushions that sit between the thigh bone and the shin bone. Typically, in the arthritic process, there will have already been some destruction of the menisci. The surgeon will remove the remnants of these structures. We now have very good access to the deep bone structure. Your surgeon will use various jigs and guides along the bone in order to resect any remaining cartilage and small pieces of bone. This will be done in order to give good access now and space to the knee components. Additionally, these guides will allow the surgeon to properly align the new knee replacement. Let's take a look at this model. This is the thigh bone, this is the shin bone. You can see that we have fashioned the ends of the bone here for acceptance of the new prosthesis. Let's bring the thigh bone to the front, and we can take the new metal prosthesis that's going to fit on the end. Now, this prosthesis comes in different sizes that are available to your surgeon during the operation to fit your particular anatomy. So let's apply the new metal prosthesis on the end of the thigh bone. You can see we have a very nice fit. Typically, this will be cemented into place with a special cement called methyl methacrylate. Let's bring the top of the shin bone into position. You can see that we have a very nice flat cut on the top. Additionally, there's a central hole that has been punched into the top of the shin bone. That is for acceptance of the metal tibial component. Tibial component will be applied on top of the bone and typically cemented into place as well. Next, your surgeon will place a very special plastic called polyethylene in between the two bones. Polyethylene also comes in different sizes and thickness available to your surgeon during the procedure. This particular type of polyethylene is called a rotating platform. When you apply it, you can see that this allows a little bit of spin on top of the tibial base plate. The more traditional polyethylene is called a fixed bearing. In the fixed bearing polyethylene, this plastic will actually be snapped into the underlying tibial tray. So let's bring the two edges of the bone together. You can see that we've created a very nice, normal hinge joint with good flexion and extension. The surgeon next will need to evaluate the ligaments on the sides of the knee. Sometimes the arthritic process will have caused the ligaments to have some laxity or tightening on one side or the other. If that occurs, your surgeon may need to do some partial releases of the ligaments in order to reestablish the normal balance of the knee. Lastly, your surgeon will turn his attention to the kneecap. If he decides to resurface the kneecap, then a small sliver of bone will be removed and then a new polyethylene component will be cemented into place. The surgeon may then place a deep drain. He or she will close the soft tissues, apply dressings, and you'll be brought to the recovery room. Thank you for watching this video presented by My Knee Guide, your comprehensive resource to knee replacement surgery. Make sure to watch our companion video, Mary's Knee. In Mary's Knee, we take you through a unique X-ray pictorial of Mary's journey from knee arthritis, through knee replacement surgery, into recovery. This video, along with many other educational materials, can be found within the Learning Center. Thank you again.